Hi, I'm Dr. Michael Gartner, double board certified plastic surgeon, and I'm here today to do a celebrity analysis on Dolly Parton. So yes, Dolly Parton has been a celebrity for a long time, since her 20s up until today. She's a country music singer, actress, and she's always been very open that she's had plastic surgery, but she's never really disclosed exactly what she's have done, as to the best of our knowledge. Maybe a few things hinted here or there. 1955, wow, does she look different, huh? Okay. Now one of the things I want to point out here at this time at age 14 is you can look at the middle of her nose. She has a slight hump to her nose. Now if we move on to 1965, she's 19, not much has changed here. And if we look on to age 21 in 1967, not much has changed either, but on this angle you can still see she has a slight hump to her nose. 1968 at age 22, she's got the big hair going on. In 1970, around age 24, I see a few things. One is, I do believe she's had a rhinoplasty done, because before you used to notice that hump there, and now there's a smooth transition here. Her tip looks a little bit different. I think she had a rhinoplasty done at that time in 1970. And also, she's well known for her breasts, as we all know. I believe somewhere there or a little bit before, she had a breast augmentation performed. Now, breast augmentation has been around since 1960. It was not uncommon for celebrities at that time to enhance themselves. And she was always one of the ones who, always with the big hair, always wanted to make herself visually apparent when she walks in the room. 1974, she's doing her country music things here at age 28, looking very nice. We go up to 1979, and she's 33 years old now. And I noticed she's always had high arching eyebrows, but they look a little bit higher, and her upper lids look like they're a little bit softer, like some volume has been removed. At that time, doing blepharoplasty, it was common that you take off the excess skin and remove the fat pads. Now we don't do that because that gives a little bit more of a hollowed out look, which was actually a popular thing to do among plastic surgeons around that time. So her upper lids to me look a little bit more hollowed out. I believe she had an upper lid blepharoplasty somewhere around that time, and maybe something done to her eyebrows, such as a brow lift. 1979 was before Botox. So that came around year 2000, so that wasn't really available at that time. To 1985, she's 39. Now her face looks a little tighter here. She always has her hair in front of her ears, but I think more so in her later years to hide any facelift scars. A facelift scar usually is a scar in the sideburn area, comes in front of the ear behind this thing that sticks out called a tragus, and then comes around the earlobe and then behind the head. So she never really exposes that area again. And since her face looks a little tighter, I think somewhere around this time or a little bit sooner, she may have had a little tweak, a little mini facelift performed. And she's admitted she's had little tweaks, and I believe she's had little mini facelift tweaks multiple times, but very nicely done, very well done. So it's very difficult to see exactly when or how many she's had of those. But she's definitely probably had a few in her lifetime. 1988, at age 42, her nose looks a little bit different. It looks a little more tweaked to me. It looks a little more refined. So I believe she's had a secondary rhinoplasty done. And I think also she had her breast augmentations done with larger implants. 1989 at 43. Usually the normal aging part of the breast is you don't have that shelf-like look. So the only thing that could be is an implant, and they do look larger than they were years before. So then we're moving on to 1990 at age 44. She's looking really nice, probably taking great care of her skin and looking very nice here. 1991 at 41, not much changes. And then we move on to age 48, 1994. Her cheeks to me look a little fuller. So I think around this time she may have had a small cheek implant, or she may have had some fat grafting in her face. This was a little bit before fillers, so I believe possibly she had one of those two procedures performed. Around 1999, you can see she overall looks a little smoother. This was around the time Botox started, so she may have gotten some Botox treatment. At that time, they were also injecting collagen. Her lips in this picture do look a little bit bigger, so she probably had some collagen injection to her lips to enhance them a little bit. 2001, looking really nice. Her face looks great without a wrinkle on it, so I think by 2001, she was definitely getting some Botox treatments, getting some injectables. Her cheeks look nice and full. She may have been getting a little more volume in that area as well, and her lips look nicely enhanced. 2006, at age 60. Her skin on her upper lids look a little tighter, so she may have had like another little tweak of her upper lids, another little upper blepharoplasty performed, but she's obviously doing great skincare at this time, and she's getting Botox with some filler treatments. You can see some irregularities of her nose in this picture, which is an indication that she may have had a rhinoplasty, as I suspected at some point. Here in 2009, at age 63, you can see now she's developing a little more crepiness around the eyes a little bit, and she has some crepiness like around her mouth area and below her cheeks right here in this photo here. And then the next year, everything looks tighter. She's probably getting some skincare tightening devices at this time, and I do believe she may have had another little tuck to her upper lids, because by 2010 at age 64, everything looks perfectly smooth. Age 70, 2016, her face does look a little tighter than it did in the past. So I think somewhere around this time, she may have had another kind of mini face lift tweak done. Once again, very nicely done. Her brows look a little higher. I think she's done something as well to maintain her brows. Now that could be some Botox at this time, but she could have also had maybe a revision brow lift to keep it up a little bit higher, as it always has, because brows usually don't stay that high as we get older. 2017, she's looking very nice at age 71. 2020, her breasts look a little bit smaller to me. So I think she had a third, possibly breast augmentation at the time, to put smaller implants in. Many times when it's done with a lift as well. Her chest looks a little smaller, which is very common for someone who has large implants to do later in life, because it can add to the weight of the back and the neck, and could put some kind of strain on the body as we get older. I think she had her fun with them while she was younger, and now she's downsizing a little bit, but she still obviously likes her fun, otherwise she would have removed them completely. Now she's moving on to age 75. Don't see much change here. Age 76, once again, the eyelids can get a little creepy over time. I do think she's had another tweak there. If we kind of look the year before, at age 75, you can see some crepiness and wrinkling in this picture, where it's pretty much gone by the 2022 at age 26. So I think it's possible she's had another little tweak to her eyes there, and then up to this year. And she's looking really good. I think she has had a lot of tweaks along the way. Her neck looks consistently tight. Most necks, look a little lax as time goes on. Hers never has. And she's admitted to having tweaks. I think her plastic surgeon has done a great job. I think it's done very tastefully and very nicely. She has invested a lot in her looks. Obviously, she makes a lot of money. She's able to do that. And I think it's paid off for her very nicely, in that she's maintained wonderful youthful looks. And I applaud Dolly Parton for being open about her plastic surgery. And if you're interested in getting evaluated yourself and wanting to look a little younger, look me up. I'll be happy to see you for a consultation.